indicate if you're able to hear me clearly. All right, that's good enough. Right, so moving on to the next system, which would be the circulatory system. So the circulatory system includes the heart, which is the pump, which pumps blood through a network of blood vessels to all parts of the body. That's the main function of the circulatory system, to circulate blood to various areas within the body. And that is done by maintaining a specific blood pressure within the body. Now, the circulatory system consists of the blood vessels, which are referred to as pipes at time, and the blood, right, or water within the pipe, right? And a part of blood is water, a part of the blood is cells. And we're going to break it down. The flow of blood. So blood picks up oxygen in the lungs and goes to the heart. And that's the only place the blood can pick up oxygen, right? The heart pumps it to the rest of the body. And when it goes to the systems within the rest of the body, the cells within these systems will absorb the oxygen and nutrients from the blood.
Mr. Rufus, I'm not hearing you.
You're not hearing me? If the others hearing me?
Yes.
All right, so the person that's not hearing me would be a connection problem on your end, not on my end. So the cells absorb oxygen and nutrients from the blood and release waste products. The blood carries the waste back to the lungs and the kidneys, and in the lungs, the blood exchanges the carbon dioxide for more oxygen. So it's a continuous process.
Carrie, in the hearing me?
Yes.
I'm not hearing anybody.
Oh, check. I'm not sure. Check your mic. Anyone else having the problem? No, I'm hearing okay.
Hearing loud and clear from this end?
Yes.
All right, can I continue?
Yes, and then we're hearing him. Okay, go ahead, Mr. Rufus.
All right. Okay. All right. Let me, before I go to this, let me backtrack a bit. All right. So the circulatory system consists of the blood vessels. You have blood vessels that carry blood towards the heart, and you have blood vessels that transfer blood away from the heart. And the blood vessels responsible for transporting blood towards the heart are the veins, or this is referred to as the venous system. Now, the venous system primarily carries deoxygenated blood. So the blood that is transported via the veins primarily consists of primarily is deoxygenated, so it doesn't have oxygen in it, right? However, there is an exception. So primarily the veins carry deoxygenated blood, with the exception of the pulmonary veins. The pulmonary veins are the veins that will take the oxygenated blood from the lungs to the left side of the heart. The right side of the heart is responsible for the movement of deoxygenated blood, and the left side is responsible for the movement of oxygenated blood. So that's the veins. So again, veins carry blood towards the heart, and they primarily carry deoxygenated blood, with the exception of the pulmonary veins. So the pulmonary veins carry oxygenated blood from the lungs to the left side of the heart. Now, the arterial side of the circulatory system, the arteries, A is for away. So the arteries carry blood away from the heart, with the exception of the coronary arteries, right? So the arteries carry blood away from the heart, with the exception of the coronary arteries. The coronary arteries are the arteries that supply the heart muscle with blood. And this is the artery that is usually obstructed when a patient gets a heart attack. Now, primarily, the blood that is carried by the arteries is oxygenated. So primarily, the arteries carry oxygenated blood, with the exception of the pulmonary arteries. So the arteries primarily carry oxygenated blood, with the exception of the pulmonary arteries. The pulmonary arteries will transport deoxygenated blood from the heart to the lungs. So the pulmonary arteries are the only arteries that carry deoxygenated blood. Now, the arterial side of the circulatory system is referred to as the high pressure side of the circulatory system, and the venous side of the circulatory system is referred to as the low pressure side. All right, now the heart consists of 4 chambers, and the heart is a muscle, and that's why it is referred to as the myocardium. The chambers work together to pump blood to the lungs and to the rest of the body. The upper chambers of the heart are referred to as atriums, and the lower chambers of the heart are referred to as ventricle or ventricles. The left ventricle is the largest chamber of the heart, and it is the largest chamber of the heart because it is the chamber of the heart that does the most work. So that would be the left ventricle. Inside the heart and outside of the heart, there are valves, one-way valves, which allow the blood to flow in only one direction. And when these valves open and close, it is what creates the heartbeat. So when medical personnel are listening to a patient's heartbeat, they're actually listening to the valves open and close. All right, so in this diagram, the blue vessels are the veins, the red vessels are the arteries, right? And basically what happens is deoxygenated blood, so deoxygenated blood from the upper portion of the body and the lower portion of the body will travel via the vena cava, which has a superior and inferior portion. So this deoxygenated blood will travel via the vena cava, which is the largest vein in the body. This deoxygenated blood will end up in the right atrium. So it ends up in the right atrium. When the right atrium contracts, it pumps this deoxygenated blood into the right ventricle, right? So the deoxygenated passes through a one-way valve and it ends up in the right ventricle. Then the right ventricle contracts and pumps that blood up through another valve, one-way valve, into the pulmonary arteries, which goes to the right and left lungs, right? When it ends up in the lungs, it becomes more oxygenated. So it picks up the oxygen that it needs and gives off the CO2. Then that oxygenated blood will be pumped from the lungs via the pulmonary veins, right? So the oxygenated blood will be pumped via the pulmonary veins into the left atrium. The left atrium then contracts and pushes that blood through a one-way valve into the left ventricle, which is the largest chamber of the heart. The left ventricle then pumps blood through a one-way valve into the aorta, which is the largest artery in the body. And the aorta has a ascending and descending portion. The ascending portion goes to the upper portion of the body, and the descending portion goes to the lower portion of the body. When this oxygenated blood reaches the cells or system within these areas, the exchange occurs again and the blood becomes deoxygenated. And then the cycle repeats itself. So it's a continuous cycle of the blood circulation. The arteries carry blood away from the heart. So A is for away. Arteries primarily carry blood away from the heart at high pressure and therefore have thick walls. The exception to that is the coronary artery. So the coronary arteries supply the heart muscle itself with blood. There are three major arteries that you are required to be familiar with as an emergency medical responder. you need to be familiar with the Carotid Artery, which is in the neck. It's a central artery. And you need to be familiar with the Femoral Artery, which is in the groin region, inner thigh, and the Wrist Artery, which is the radial artery. That's the one that is in line with the thumb. Right, now the capillaries are the smallest blood vessels in the body, and the importance of the capillaries is that the capillaries connect veins to arteries. Who is that? Mr. Hawthorne, go ahead.
Yes. Could you go back to the previous slide just for a second?
That
The one before that. No, the one before that. Yes. All right, thank you.
All right, cool. Mute your mic. All right. The capillaries connect the smallest veins and the smallest arteries, right? And the smallest veins in the body are referred to as venules, and the smallest arteries in the body are referred to as arterioles. So it's a connection point. And at the level of the capillary, the process of diffusion can occur, where the exchange of oxygen occurs. Now, the blood has several components. It has plasma, which is the fluid portion of the blood for transporting stuff. It has red blood cells, and one of the main function of the red blood cells is oxygenation, right? So the red blood cells are essential to the process of oxygenation. And the red blood cell requires 4 oxygen molecules in order to be properly oxygenated. The white blood cells are essential to fighting invading microorganisms. So it fights infections. It is important to the immune response. It is important to allergic response. Platelets are important to the clotting process. And we'll leave it at that. Right? And that would be the circulatory system. Are there any questions before I move on to the next system?
Plasma. What's plasma responsible for again?
That's the fluid portion of the blood. Transport all of these components.
All right.
Excuse me. All right, so the next system we're going to look at is the skeletal system. So the skeletal system consists of bones and is the supporting framework of the body. It has 3 major functions: to support the body, to protect vital structures, and to manufacture red blood cells. And another important function of the skeletal system is it stores minerals. Now, the skeletal system is divided into what is referred to as the axial skeleton and appendicular skeleton. So you have the axial skeleton and you have the appendicular. Let me use my pencil. The axial skeleton is the center portion. So that's this portion, right? So the axial skeleton is the skull, the rib cage, and the spinal column. That's axial skeleton. I always tell students it's a centerpiece, right? So the axial skeleton consists of the skull, the rib cage, and the spinal column. That's axial. The appendicular is the attachment for the extremities. So it is the attachment for the extremities, the shoulder girdle and the pelvic girdle. So that is what is referred to as the appendicular skeleton. Shoulder girdle and pelvic girdle. The shoulder girdle is the attachment for the upper extremities, and the pelvic girdle is the attachment for the lower extremities. Right, and everything on this slide are areas that you probably need to be familiar with, right? So the skull, collarbone or clavicle, the humerus, which is also referred to as the funny bone, radius in line with the thumb, ulna in line with the pinky. That's the two bones in the forearm. You have the rib cage, which is the thorax. The sternum is where majority of the ribs are attached. Well, let me not say majority. Some of the ribs are attached directly to the sternum. You have the vertebral column. You have the pelvis. You have the femur, which is the largest long bone in the body. The patella, which is the kneecap, fibula, and tibia. Tibia is a shin bone. So these are some bones that you need to have some familiarity with when you're treating a patient in the field. So let's look at the skull. The skull. Bones of the head include the skull and the lower jawbone. The skull consists of many bones fused together to form a hollow sphere that contains and protects the brain. The jawbone is a movable bone that is attached to the skull and completes the structure of the head. The spine or spinal column consists of 33 vertebrae. The spinal vertebrae are stacked on top of one another and are held together by muscles, tendons, discs, and ligaments. Now, the purpose of the spinal column is to protect the spinal cord, and the spinal cord exits the skull through an opening referred to as the foramen magnum, and that's at the inferior portion of the skull. the spine has 5 sections. So you have the cervical spine, which is the neck portion. You have the thoracic spine, which is the upper back. You have the lumbar spine, which is the lower back. You have the sacrum, which is the base of the spine. And you have the coccyx, which is the tailbone. And each of these sections have a certain amount of vertebrae. So there are 7 cervical vertebrae, 12 thoracic, 5 lumbar, 5 sacral, which are fused, sacrum, and you have 4 coccygeal, which are fused and form the coccyx. And you can see where the spinal cord nerves branch out of the spinal column on the left side of that diagram. So you have nerves going to the upper extremity, and you have nerves going to the lower extremity. Now, if there is damage to a section of the spinal column, and that damage cuts off the nerve impulses, it can lead to paralysis of the 4 limbs, or it can lead to paralysis of half of the body or the lower portion of the body, right? And if it's in the region, so if the damage to the spinal column is in the region of the cervical spine, it can cut off the patient's ability to breathe or ventilate. So a patient with suspected spinal injury need to be moved in a way where the spine is not compromised. All right, now the shoulder girdles. Each shoulder girdle supports an arm and consists of 3 bones. So you have the collarbone, which is the clavicle. You have the shoulder blade, which is posterior, that's the scapula. And you have the upper arm bone, which is the humerus, sometimes referred to as a funny bone. The upper extremity consists of the upper arm, and it has one bone called the humerus. The forearm has 2 bones called the ulna and radius. The ulna is in line with the small finger or pinky finger, and the radius is in line with the thumb. And if you palpate close to where the thumb is on the radius, you will be able to feel the radial pulse. The wrist and hand consist of several bones. Now, the rib cage, 12 sets of ribs protect the heart, lungs, liver, and spleen. The sternum is located in the front of the chest. That's the breastbone. And at the inferior portion of the sternum, we have what is referred to as the xiphoid or xiphoid process, which is an important landmark to avoid when doing chest compression. So when we're doing chest compressions on a patient that requires CPR, we want to avoid that location. Then you have cartilage, and you have the various ribs. Now, the floating ribs only have a posterior attachment, right? So the floating ribs have no anterior connection. They only have posterior connection to the spinal column. That's why they are referred to as floating ribs. The pelvis. The pelvis serves as the link between the body and the lower extremities. That's why it's referred to as a pelvic girdle. Yes, Mr. Arthur.
You're saying that when doing chest compressions, you're supposed to avoid a certain area. Could you say what that was again?
When you're doing chest compression, you don't want the palm of your hand close to the xiphoid process because it can break off easily.
Okay. Thanks.
All right. All right, so the pelvis serves as a link between the body and the lower extremities. It protects the reproductive organs and other organs located in the lower abdominal cavity. The lower extremity, each lower extremity consists of the thigh and the leg. The thigh bone is referred to as the femur. It is the longest and strongest bone in the entire body. The leg has two bones called the tibia. Tibia is the shin bone, and then you have the fibula, which is more lateral. The kneecap is the patella, and is small and flat bone that protects the front of the knee joint, and that's the purpose of the patella. It protects the knee joint. The ankle and foot contain a large number of small bones. And we're not going to get into what these bones are called. It's not necessary for the scope of this course. All right, now joints. There are multiple joints within the body. So multiple joints, whole heap of bones within the body. The joints, however, fall in three categories. So regardless of the type of joint, it's going to fall in three categories. It's either a joint that has free movement, like the shoulder joint, free movement, or it is a joint that has limited motion, like the elbow joint, which is a hinge joint, or it is a joint that has no motion, and that would be like the fibrous joint in the pelvis or joints in the skull. So joints, where two bones come in contact with each other, a joint is formed. And the two bones that come into contact at a joint will form the name of the joint. They are held together by supporting tissues called tendons and ligaments. Tendons connect muscle to bone. So tendons connect muscle to bone. Ligaments connect bone to bone. And the joints are lubricated with thin fluid that is contained in a sac surrounding the joint. So, as I said, the three categories that you need to be familiar with: free movement, which is an example of that would be a ball and socket joint. Limited movement would be a hinge joint, and no movement would be a fused joint. Excuse me. All right. Are there any questions before I move on to the next system? All right, so let's move forward. The musculoskeletal, muscular system. I'm going to spend a lot of time on this system. The skeletal muscles provide support and movement, and alternately contract and relax for that movement to be coordinated. And there are 3 types of muscles in the body. You have the skeletal muscles, you have the cardiac muscles, and you have smooth muscles, which are found within the intestines and the walls of the arteries. So smooth muscles carry out automatic functions, and they are also called involuntary muscles. Cardiac muscle is found only in the heart. All right, do I need to mention anything else about muscles? No. And that's it for the muscles. The nervous system. The nervous system governs the body's function, and it consists of the brain and the spinal cord, which is often referred to as the central nervous system. And it consists of the spinal nerves and cranial nerves, which are, and that section is referred to as the peripheral nervous system. So you have the central nervous system, which is the brain and the spinal cord. And then you have the peripheral nervous system, which is the cranial nerves and the spinal nerves. Now, the purpose of the brain is the central control unit, and the spinal cord is the link between the brain and the rest of the body. Now, there is a portion of the nervous system that deals with voluntary activity and a portion that deals with involuntary activity. So there's a portion that the brain has direct control over, and then there is a portion where the brain doesn't have to have direct control over that. We can also get what is called a spinal reflex from the nervous system. And what that means is the signal is bypassing the brain. So, for example, someone picks up an object, the object is hot, so it's a hot object. The sensory nerves in the fingertip will pick up that sensation of heat, and then that signal will travel via the sensory nerve to the connective nerves via the spinal cord, and then go to the motor nerves, which take it to the fingertips, and we release the object. So that sensation of heat that is picked up does not reach the brain before a response is created. That is what is referred to as a spinal reflex action. So it's bypassing the brain. It's traveling via the sensory nerve to connective nerves to motor nerves, then a movement is created. Because if it's not, then we would have the object the person would have the object in their hand too long, and that would cause damage to the tissues. So it's a protective reflex. Now, the brain is the body's central computer, and it controls the following functions: thinking, voluntary actions, and involuntary functions. So as I said before, there is a section of the nervous system that deals with voluntary functions or actions, meaning the brain has direct control. And there is a section of the nervous system that deals with involuntary functions. The spinal cord is a long tube-like structure that extends from the base of the brain. And that's all you need to know on the nervous system. No need to get complicated. Any questions before I move on to the next system? Okay. All right, the digestive system breaks down food into a form that can be carried by the circulatory system to the cells of the body. The food that is not used is eliminated as solid waste. Major organs of the digestive system are located in the abdomen. Right? The digestive tract begins at the mouth and continues through these structures: the throat, the esophagus, which leads to the stomach, where acid starts to turn the food into a semi-liquid state. Then it goes to the small intestine. When it goes to the small intestine, majority of the water and nutrients will be absorbed. When it goes to the large intestine, whatever water is left is absorbed, and then we start to get stool forming, goes down to the rectum, then it leaves via the anus. Mute your mic, Mr. Arthur. Mute your mic. Now, the digestive system also includes 3 other organs: liver, which have multiple functions, gallbladder, important to the breakdown of bile, and the pancreas, which is important to, it has some digestive function, but it also plays a role in how the body utilizes glucose. All right. Now, genitourinary system, responsible for the body's reproductive functions and for the removal of waste products. Major male reproductive organs include the testes, which produce sperm, and the penis, which delivers the sperm. The major female reproductive organs includes the ovaries, which produce the eggs, and the uterus, which holds the fertilized egg during pregnancy. The egg is released by the ovaries and travels to the uterus through the fallopian tubes. The external opening of the female reproductive system is referred to as the birth canal or the vagina. Now, the removal of waste products begins in the kidneys, which filters the blood to form urine. So the kidney is basically the toilet of the human body, and if there is not enough water in the toilet, it can't flush. So in order for the filtration process to occur, enough water must be there. The urine flows down from the kidneys through the tubes, ureters into the bladder. The bladder collects and stores the urine before it passes out of the body through the urethra. The skin, largest organ in the body. The skin covers all parts of the body and it has 3 major functions. It protects the body against harmful substances in the environment. It regulates body temperature and it transmits information from the outside environment to the brain. There are 3 important layers that you need to be familiar with for the skin, right? You have the subcutaneous layer, which is the fat layer. Then you have the dermis, which is the middle or inner layer. And then you have the epidermis, which is the outer or top layer. Right? And there's a diagram showing that quite nicely. So you have the subcutaneous layer, which is the area with the fatty tissue. You have the dermal layer, where you have important blood vessels and nerves, and they have the outer surface or upper layer, epidermis. The skin is an effective barrier to bacteria and viruses as long as it is not broken by injury. The skin can perceive or sense touch, pressure, pain, and degrees of hot or cold. All right, now let's look at stages of life, growth, and development. Throughout a person's life, the body changes constantly. In an infant, so infants, their airway is smaller, they are top heavy, so pediatric patients, young pediatric patients, they tend to be top heavy, them head big, them airway small, their tongue takes up a lot of space in the mouth, right? And their ear passage is very narrow and their epiglottis is bigger in comparison to adults. So with young pediatric patients, they are at a high risk for airway obstruction. So in an infant, the airway is very small and is easily obstructed by swelling or objects. Because toddlers have poor coordination, so toddlers, the coordination is not that great and them top heavy, they will lose their balance and fall, and because they are top heavy, they will always go down head first. School-age children are physically active and prone to injuries, not this generation, right? So the school-age children now, not that active. And an infant would be after they reach 1 month to 1 year. That's an infant. Toddler is 1 to 3. And school age, I believe, is 3 to 5 or 6. Right? This current generation is not active. They tend to be more engaged with social media, tablets, games, phone, not very active. Now, the body changes constantly. Adolescents do not fully understand consequences of dangerous actions. So these are the teenagers now, right? When they start to get to that age, they don't understand that their actions can have serious consequences and they take a lot of risks. And there some not all, Some are easily influenced by peer pressure. In early adulthood, this is a period when most body systems are fully developed. In middle adulthood, this is generally the time when the body systems start to decline. Now, during late adulthood, these declines become more pronounced. So as we get older, basically, this is what this slide is saying. As we get older, the systems in the body becomes less effective in their functioning capacity, and this can lead to problems. Now, vital signs. So as EMRs, you should be able to obtain some vital signs on your patient. Now, I don't think I'll be teaching you how to obtain a blood pressure, because I don't think you can get full grasp of that in just a week. But definitely you should be able to obtain a pulse rate and respiratory rate. So the most commonly measured vital signs are pulse, which is an indication of how well the heart is beating, and the respiration, which is an indication of how well the patient is breathing, and blood pressure is an indication of how well the heart is pumping blood out and that blood is circulating. Right now, when you're going to obtain a pulse rate for a patient, you will palpate the peripheral pulse, which would be the radial pulse. So we go for peripheral pulses when the patient is communicating, right? So when a patient is talking to you, you will feel the radial pulse. If the patient not talking to you, you go for the pulse that is closest to the brain. That would be the carotid pulse. When you're going to obtain a pulse rate, you put pressure on the pulse, and you need to create pressure on that pulse where it runs over a bone. That's the best place to feel a pulse. You will count the pulsations for 1 minute. So you count it for 1 minute, and that would be the pulse rate per minute. When you're going to obtain a patient's breathing rate, you have to observe the patient, right, the rise and fall of the patient's chest, and as a single movement of the patient breathing in and out is counted as 1. So when they breathe in and out, that's 1. You're going to count that pattern of breathing for a full minute, and that would give you the patient's breathing rate per minute. Now, if you're obtaining a patient's breathing rate, the patient should not be communicating to you at that point. So the patient shouldn't be talking to you, and don't tell them that you're going to be checking their breathing rate. Just tell them that you're going to be doing some checks on them. So if they know that you're going to check their breathing, they're going to alter the breathing pattern. If they're talking while you're obtaining the breathing rate, that can also alter the breathing rate. You won't get an accurate one. So definitely we will be practicing that for the 2 days of skill, which would be Thursday and Friday. Blood pressure, I don't think we'll be going down that path. Now, normal vital signs change with age. Normal pulse and respiratory rates decreases, right? Now, the younger the patient, the faster they breathe and the faster the pulse is going to be, the younger the patient is. Normal pulse rate for an adult is 60 to 100 beats per minute. Shouldn't be below 60, shouldn't be above 100. Now, do not use a rate alone to determine if something is seriously wrong with your patient, right? You have to look at the patient presentation as well. For example, a person can have a pulse rate below 60 and nothing is wrong with them. The patient just has a very robust cardiovascular system because they are athletic, they have been playing football for a while, or they do track and field, so their heart muscle and lung capacity is well developed. So that person is going to have a pulse rate below 60 and it's fine. But if you have someone with a pulse rate below 60 and the person is telling you that they feel lightheaded, or they feel like they're about to pass out, or their heart don't feel good, it means that that pulse rate is causing a problem for that patient. So you have to look at the patient's presentation and then consider the numbers. So the point I am making is we don't treat numbers. Numbers are a guide to our assessment process, right? And it's the same thing with the breathing rate. So the normal breathing rate for an adult is 12 to 20 breaths per minute. For a PD, you're looking at about 15 to 30. Infant 25 to 50, can go over 50. And these are numbers. The younger the patient, the faster the patient is going to breathe. However, as I mentioned before, a person can have a breathing rate that's a little below 12, not significantly below 12, but a little below it, and they're fine because their lung capacity is well developed and they're athletic. So you have to look at the patient presentation, right? Now, if a person has a breathing rate that's low and they are complaining of, not even complaining of anything, they're just not communicating properly with you. They seem confused, they seem disoriented, or their skin color is changing, where the skin has a pale color or blue, then it means that that slow breathing is causing a problem. So always look at your patient's presentation and consider the numbers. We do not treat numbers in EMS. Now, once a patient's blood pressure is not adequate, the body will compensate for that drop in the blood pressure by constricting the blood vessels in the body to increase the pulse rate and get more blood going to the heart. So that's a compensating mechanism. Blood pressure fall, pulse rate goes up. And usually you're gonna see breathing rate go up as well, because the person are gonna need more oxygen inside of the body. All right, that's a chart. When I send you the PowerPoints, you can look at that chart. Now, factors that can change vital signs: exercise, fever, illness, pain, stress, excess body weight. These can cause vital signs to go. Decreased vital signs: athletic condition, blood pressure medication. Variations in normal vital sign values depend on 3 factors: the person's size, the person's degree of physical conditioning, and the medication that the person takes, if they are on any medication, right? So the moral of the story is the better shape your body is in, the less stress is put on your systems within the body, right? And exercise must involve specific things. So you can't be focusing on one aspect of exercise, right? Exercise should involve strength training, flexibility, and aerobic activity. You need to have a mixture of all three. All right, now in summary, the respiratory system consists of the lungs and the ear passage or airway. The circulatory system consists of the heart, which is a pump, blood vessels, which is the pipes, and the blood, which is a fluid. The skeletal system consists of the bones of the body and the other structures. The musculoskeletal system consists of three kinds of muscles. Voluntary, which is your skeletal muscle. So primarily, the skeletal muscles are voluntary, but the diaphragm has both involuntary and voluntary functions. Smooth muscles are involuntary, and the smooth muscles are found in the intestines and the walls of the arteries. And then you have the cardiac muscle. The nervous system consists of the brain, the spinal cord, and the individual nerves. And there's a portion of the nervous system that is responsible for voluntary function, meaning there is direct control from the brain. And there is an area of the nervous system that is responsible for involuntary function, meaning the brain is not directly involved. A spinal reflex is a reflex action in which an impulse bypasses the brain to get a faster response from the muscles. The digestive system consists of the mouth, the esophagus, stomach, intestines, liver, gallbladder, and the pancreas. Excuse me. The genitourinary system consists of the organs of reproduction together with the organs involved in the production and excretion of urine. The skin protects the body from the environment. It regulates the internal temperature of the body, and it transmits sensations from the skin to the nervous system. Vital signs change at different points of the life cycle. All right, now question 1. If you know the answer, raise your hand. Which of the following patients is in the anatomic position? Anybody have an answer for that question if you're still around? Go ahead, Kim.
Sorry, I would go with B.
B as in boy.
Yes.
Okay, let us find out. And that would be correct. Michelle, were you going to respond?
That's the same answer I had.
All right, noted. All right, number 2. When referring to the human body, the term proximal means. Go ahead, Mr. Grant. Not hearing you. Go ahead, unmute your mic.
Oh, sorry about that. Is the answer A?
A as in apple.
Yes.
Let us find out.
Yay.
That would be correct. All right. Next one. The respiratory system is responsible for. Taking too long for this one. Come on. Shouldn't take it that long.
D.
B or B as in boy or D as in dog?
D for dog. D.
Oh. If you said D, that would be correct. Yes, Michelle, go ahead.
Yeah, well, the answer is there already.
Oh, you were going to answer. All right. All right, and I think that would be it for the questions. So that's an idea of what the questions will be like. Not too complicated, even though there's a lot of information. Let me stop this recording. So the session is being recorded. As soon as you have access to the platform, you will have access to the recordings.